Hi, I'm Steve Latham with the Yale Interdisciplinary Center for Bioethics, and I'm speaking today with Alex McKeown. Welcome.
Thanks very much.
Alex is teaching in the summer program this summer, and I just wanted to start off by having you tell us a little bit about your own educational background.
Okay, well, I'm a postdoctoral researcher in the Department of Psychiatry at the University of Oxford, and I work in a group called Neuroscience, Ethics and Society, where we're an interdisciplinary group of bioethicists, so philosophers, sociologists, psychologists, and we're all broadly interested in the relation between neuroscience, ethics and society, so we're interested in the implications of neuroscience research and research into psychiatric illnesses.
And what's your own disciplinary background?
My background's in philosophy, so I did a BA in philosophy, and then several years later I did a master's in healthcare ethics, and then after that I worked for a few years in policy and education research in genetics for a patient organisation in the UK, and it was towards the end of that that I realised that I wanted to go back and pursue bioethics some more in an academic setting, so I did my PhD in bioethics, and my thesis examined the ethics of human enhancement, which is the subject that I'm also teaching this year at the Summer Institute.
Yes, well, that was going to be my next question. But what kind of research work do you do in the postdoctoral institution where you are now in Oxford?
At the moment, I do several things. At the moment, the thing that takes up most of my time, that occupies most of my time, is a European consortium project looking at ethical issues in Alzheimer's disease research. So, trying to use unused data sets to improve outcomes for people with Alzheimer's disease across the spectrum of the disease. And it has a focus on ethical issues in prevention and early diagnosis and testing for risk of developing the disease. So that project is due to come to an end at the end of this year, and I'm going to be moving on to some other work relating to. Actually, I can't say too much about that because it's not confirmed at the moment. So,
all right.
Yeah. That project is coming to an end at the end of this year, and I'm working on some other projects broadly around issues relating to prevention of mental health illnesses.
Great. So you were saying you were teaching about enhancement in the summer program.
That's right.
For people who aren't familiar with the topic, what does teaching about enhancement mean in a bioethics program?
Okay, so human enhancement, broadly speaking, I mean, it's a vast topic, and there are several definitions of what it might mean. But broadly speaking, we can say that human enhancement thinks about the implications of using medical technology, biotechnology, to rather than just to restore health and normal functioning in a way that conventional medicine does, but to create new norms of health and functioning that go beyond normal functioning in health. So this has a kind of a history, for example, in performance enhancement in sport.
Things like blood doping and.
Blood doping, yes, and it's an issue that it sort of it used to be in the bioethical kind of it's emerged into the bioethical mainstream in the last 15 years or so, partly because thinking about what might be possible in the future and how far we might be able to extend our capacities has always been a question of interest, I think, to bioethicists, but it's been very speculative. But because of developments, for example, in genetics and pharmacology.
Artificial intelligence? I
mean, artificial intelligence certainly touches on it, because the prospects of AI and human-machine integration may offer possibilities for enhancing our capabilities. I mean, that's not something specifically that I am looking at or teaching in the program, because I've had to select a range of issues that I think would be most relevant to the students. But yeah, I think, I mean, broadly speaking, enhancement is interesting. What else we might be able to do with medicine rather than just restore health from illness. Mm-hmm. And we're covering some. What I'm teaching is essentially a crash course in the ethics of human enhancement, because it's such a vast topic, and I've selected what I take to be some kind of salient and central issues that are going to be useful for them. And I've excluded, I mean, there's a lot of very interesting theoretical work at the sort of at the kind of speculative end of the bioethical discourse about enhancement. For example, what a post-human what a post-human race might be like. If we could enhance ourselves so much that we really change what it is to be a human being, or Homo sapiens in the way that we take ourselves to be, then what might be the implications of that? But of course, that's rather hypothetical. And so I focused on the difference between therapy and enhancement, because it's a slightly nebulous distinction, given that the condition of a therapy's effectiveness is that it enhances. So it looks like there might not be a clear line between therapy and enhancement, and also the definition of normal health is very difficult to pin down, and for that reason the distinction might not be so clear. And we're also going to look at genetic enhancement, the kind of unhappy legacy of human enhancement in the eugenics movements of the 20th century. We're going to look at cognitive enhancement, because one of the main topics of interest in enhancement discourse is the use of pharmaceuticals for non-medical purposes. So, for example, the use of modafinil, which is a drug developed for people with narcolepsy, which students and others have been using to improve memory retention and concentration. And the use of Adderall, a drug developed for people with ADHD, which has also been used for these purposes. And we're going to cover physical enhancement, so doping in sport and other kinds of physical enhancement. And I mean, there's a lot that we've had to leave out, but it's going to provide a kind of a grounding in the core ethical issues.
And you're about halfway through now, right?
That's right. Taking the first half of the seminars. The second half.
How's it going?
I'm really thoroughly enjoying it. It's great. I mean, I came here in 2016 and thoroughly enjoyed it, and now I'm enjoying it just as much this time. It's great because the group that I have they're a really engaged, really enthusiastic bunch, and they've asked me some very difficult questions, which is really good, because it's important to be challenged, particularly seeing as at home I just do research, I don't do any teaching, and so I'm delighted to be able to do some teaching, because it's always one always finds what one doesn't know when one has to teach something.
Right. Yeah. There's an old American graduate student joke. Read it. I haven't even taught it yet.
Right.
Which is partly funny because the idea you would teach it before you read it, but partly also funny because it turns out you don't read things really thoroughly until you have to answer other people's questions about them.
Yeah, that's right.
Yeah.
And you can also be blindsided by people who are less familiar with your topic. You can be blindsided by what appear to be very simple questions, and it's easy to, once you've assumed a certain amount of knowledge about something, it's easy to sort of it's easy to forget that other people aren't so familiar with it, and you might need to give some clearer explanations of what it is you're talking about. So it's great. It's really, really great.
Good. So what's the main thing you're going to get out of this for yourself? Is it just a more thorough grounding in your own area because of the experience of teaching it? Or are you going to be working with other people from here in the future, do you think? Or
I think that it's always good to refresh. It's good to refresh my knowledge about what I'm talking about. I mean, the things that I'm covering, I've been thinking about for a long time now, for the best part of a decade, since my PhD and onwards. So in that respect, I'm not learning anything new about the topics as such. Although it's good to be it's good to refresh that knowledge. I mean, I think in terms of what I'm getting out of it, I mean, as I've said, it's great to be teaching because I don't get to do so much of that at home, it's wonderful to be able to re-establish the connection with the centre and with the institute, because I really enjoyed being here in 2016. I'd like to think that it's offers the possibility of returning and continuing to forge the connection between our group at Oxford and the centre. So, yeah.
Excellent. Well, thank you very much.
Thank you.
All right.